Hello and welcome to our group presentation. We are the Substance Use Disorder Group, and today we'll be presenting the substance abuse case study in which we focus on the client Angela. We have 5 participants in our group: Terry Gray, Aaron Youngblood, Alexis Mayo, Carolyn Marion, and Megan Nakeen. During our presentation, we will review Angela's background, determine the most central diagnoses, answer the case questions, and incorporate research-supported treatment. Angela is a 36-year-old woman who has a long history of both mental health and substance use concerns. She's experienced auditory hallucinations on a continual basis for the last 10 to 12 years. In that same period of time, she has also used crack cocaine, heroin, and sometimes speedballs. Her drug use typically increases when she's having an emotionally difficult or unstable time. Angela has gone to rehab many times, but almost always leaves after detox, which is an indication of difficulty with long-term engagement of care. Angela's social environment has had a major influence on her overall functioning. She's been homeless for many years and tends to stay in abandoned or otherwise unsafe areas with a lot of other substance abusers. Her relationships have been marked by domestic violence and instability, and she's been exposed to significant trauma in her past. Legally, Angela has been arrested for both possession and aggravated assault. She was in prison for 18 months and required psychiatric intervention during her time there for agitation and violence. Angela has 3 children who are being raised by their grandmother. In considering Angela's symptoms and behaviors, the primary diagnoses that were identified included substance-induced psychotic disorder as well as opioid use disorder. The substance-induced diagnosis is based on the presence of auditory hallucinations that don't appear to be chronic, but rather fluctuate and change based on the use of certain drugs. Angela also has many personality traits that are dysfunctional and could be characteristic of antisocial personality disorder, including paranoia, impulsivity, and other antisocial features. Angela's case represents complex dual diagnosis concerns, which are likely related to trauma, chronic substance abuse, and instability. In regards to the first case question, the 2 most central disorders at play are substance-induced psychotic disorder and opioid use disorder. Research has established that long-term use of stimulants, particularly crack cocaine, can lead to the development of auditory hallucinations, agitation, and violent behaviors. Trauma and living in unstable environments also lead to greater risk for both psychosis and addiction. Studies on family involvement have also shown that growing up in homes where substance use is prevalent can lead to delays in seeking treatment, as well as worse outcomes when individuals do seek help. The nature of Angela's symptoms align with this dual diagnosis approach. Where should treatment be started for Angela? Regarding her psychosis, this would include antipsychotic medication to help with the reduction of hallucinations and agitation. In terms of drug use, a supervised detox would help her physical safety and stabilization of withdrawal symptoms. Once Angela is stable, an intensive, integrated, dual diagnosis program that simultaneously addresses both substance use and mental health concerns would be best. Cognitive behavioral therapy, group work, trauma-informed treatment, and long-term case management have all been shown to be effective in similar cases. In addition, housing support is also recommended to improve safety and consistency. Understanding people with more than one diagnosis is complicated and faces many challenges. The first is finding an accurate diagnosis. Misdiagnosis can occur from misunderstanding overlapping symptoms, inaccurate symptom reports from patients, and inaccurate provider training. It's especially prevalent for adolescents, minorities, and those of low socioeconomic status. A second barrier to understanding is a lack of accurate health care. If patients aren't receiving optimal, accurate, and consistent health care, the likelihood of misdiagnosis increases, and the full picture can be skewed. This contributes to the third barrier, which is inaccurate information about the patient. This happens through inaccurate self-reporting of the patient due to withholding out of fear, shame, or distrust, and inconsistency of treatment. The third case question pertains to whether research efforts should be focused on specific symptoms or on diagnostic categories as a whole. In terms of studying specific symptoms such as hallucinations, this helps researchers to learn about cognitive and neurological mechanisms that underlie these symptoms. However, diagnostic categories are still important for purposes of treatment planning, insurance, and clinical communication. The most successful approach is likely a combination of using the diagnosis to organize care, but also considering specific symptoms to improve precision in treatment. Should Angela be forced to take medication? In general, forced medication should only be considered when the individual is a danger to themselves or others, or when they're unable to make a safe and informed decision due to a lack of insight. Research shows that the combination of untreated psychosis and substance use results in exponentially higher risk of violence and aggression. Given Angela's history of agitation, aggression, and impaired judgment, it would be ethically justifiable to involuntarily provide medication during a time of acute symptom presentation for stabilization. This slide provides information from research into the neurobiology of addiction. Substance use disorders lead to changes in the circuits of the brain that control reward, motivation, impulse control, and stress response. These neurobiological changes lead to compulsive behaviors and continued use of substances in the face of harmful consequences. Angela's cravings, impulsivity, emotional dysregulation, and inability to stop using drugs are all in line with these research findings. This supports the notion that Angela needs long-term and comprehensive care rather than short-term crisis-level detox. Research has provided clear evidence for the use of evidence-based group treatments for substance use disorders. Group cognitive behavioral therapy has been shown to lead to significant reductions in relapse. Contingency management interventions in which individuals are given structured rewards for staying sober have also been proven effective. Motivational interviewing groups can be effective in helping individuals become more ready for change. The most successful results in the literature are found when these behavioral treatments are combined with appropriate medication management. This research supports the treatment we recommend for Angela. Research has also been used to show the role of personality and environmental risk factors. Personality traits like sensation-seeking, impulsivity, and hopelessness are strongly associated with addiction. Angela has many of these features. Research has also been used to show that growing up in a family environment in which substance use is normalized puts individuals at greater risk for developing substance use disorders and also creates barriers to seeking treatment. This research helps us to understand how Angela's symptoms came to be and supports the use of integrated and trauma-informed care. Angela's case presents the need for utmost consideration in cases of multiple diagnoses. Integrated treatment from multiple angles is needed, especially for such complex and multifaceted factors that address her psychosis, drug abuse, and risk of violence to herself and others. It's important that healthcare workers are committed to education and putting in the effort to find the most successful treatment for each individual. This motivation should come from a heart of compassion for each person as an image bearer of God and our call as helpers and Christians. Thank you.